Now we will discuss Medicare prescription drug coverage, also known as Part D. Part D is available to anyone who is eligible for Medicare. Part D plans are run by private insurance companies that have a contract with Medicare. The Part D plans are provided by standalone prescription drug plans and also Medicare Advantage plans. Medicare Part D coverage can be flexible in the benefit design. They must offer you at least a standard level of care. The cost and drugs cover vary from company to company. There will be different tiers and different copayment amounts. You will have a deductible, and benefits and costs change from year to year, so it's very important that you compare on an annual basis. In 2020, you will pay for a monthly premium for the Part D. In addition, you will pay a yearly deductible. You will also have co-payment amounts and co-insurances that you will be responsible for. In order to be eligible for Medicare Part D, you must have Medicare Part A and or Medicare Part B. If you join a Medicare Advantage plan, again, you must have Part A and B. And because prescription drugs are covered under most of the Advantage plans, then you must, again, have Medicare Part A and B. You must live in the plan service area. You cannot be incarcerated, not unlawfully present in the United States, and you cannot live outside of the United States. You must actually complete an application to be enrolled in a Part D. It is not automatic. There is an initial enrollment period with Medicare Part D. 3 months before your 65th birthday, the month of your 65th birthday, and 3 months after. Annually between October 15th and December 7th, you can make changes to your Medicare Part D, and the changes will go into effect January 1. If you get Medicare Part B for the first time during the general enrollment period, you can join a Medicare Part D plan between April 1 and June 30th of that year, and coverage will begin on January 1. There is an annual Medicare Advantage open enrollment period that takes place January 1 through March 31st. And during this time, if for whatever reason you are not happy with your current Medicare Advantage plan, you can make changes and enroll into a new Medicare Advantage plan that covers prescription drugs. So that allows you to change your drug plan at that time. There are special enrollment periods for individuals who have Medicare Part D. If someone has a life-changing experience, let's say you move from one state to another, you live in a long-term care facility, you enter a long-term care facility, or you leave a long-term care facility, you can make changes. For someone who has low income and qualifies for extra help, then they have a continuous, where they can make continuous changes in their Part D. So there are various life-changing events that you may be able to change the Part D outside of the annual open enrollment period. Even if you do not take medications, we encourage you to enroll in a Medicare Part D plan, because the federal government says that everyone should have a plan, and if you don't and you sign up at a later time, then there is a penalty, okay? That penalty is 1% for every month that you could have had coverage that you did not. And it is based on the national base premium. And in 2020, that national base premium is $32.74. So you will multiply the base amount of your Part D premium times that penalty, and that will calculate what your cost will be. And that national base premium changes from year to year. So even if you don't take any medications, we encourage you to enroll in the cheapest plan so that you have coverage. It's like homeowners insurance, auto insurance. You want to make sure that you have coverage in the event that you do need a prescription drug plan. Just like Medicare Part B, there is an income-related monthly adjustment amount. So if you were single, making over $87,000, or you were married making over $174,000 in 2018, you can expect to pay over the base premium for those plans. This chart basically details what you will be responsible for in addition to that base premium. These prescription plans do cover brand name and generic drugs that have been approved by the United States Food and Drug Administration for drugs that are used and sold in the United States and used for medically approved indications. These plans must cover a range of drugs in various categories, and coverage and rules are going to vary from plan to plan. There are some protected categories in which Medicare Part D plans must cover drugs. Those are for cancer medication, HIV/AIDS treatment, antidepressants, antipsychotic, immunosuppressants. So it's very important that you check to make sure that the medications that you take are covered. And under Part D, it does cover the shingle shots. I know a lot of individuals often ask if the shingle shot is covered. It is covered, and it is covered under Medicare Part D. However, the flu shot is covered under Medicare Part B. There are some drugs that are excluded by Part D plans. Those are drugs for anorexia, weight loss, weight gain, erectile dysfunction, fertility drugs, drugs for cosmetic or lifestyle purposes. Now, these Part D plans do manage access to these drugs. So some plans will have a prior authorization. That means that your doctor must first contact the plan for prior authorization, showing that it's medically necessary for you to take that medication. There are some plans that will offer step therapy. That means that you've tried less expensive drugs that are similar to the medication that you were prescribed. However, those drugs do not work for you. Therefore, your doctor will provide request an exception so that you are able to take a more expensive medication. For safety purposes, some plans will have quantity limits. They may say that you can only have 30 pills in 30 days or 30 pills in 60 days. So make sure that you check to see how the plans access their coverage to the medications. When you enroll in a Part D plan, they should send you a booklet, which is a formulary book that lists all the medications that are covered by the plans. It will tell you the different tiers that the medications are covered under. Tier 1 are going to be your lowest co-payments. Those are going to be mainly generics. Tier 2 are going to be your medium co-payments. Those are going to be preferred brand name medications. Tier 3 are going to be higher medications. Those are going to be the non-preferred brand name medications. And then they're going to be Tier 4 or specialty drugs. Those are going to be your more expensive, unique, and they're going to cost, they're going to be a high cost for those medications. So if you're interested in choosing a Medicare Part D, getting assistance from DMAB, we use Medicare's website, Medicare.gov. You can go there and we can offer you a plan comparison. You would contact our office with a list of the medications that you take, the dosage for the medications, the frequency in which you take those medications. We will then enter the information into the Medicare system and provide you with a list of the prescription plans that are offered here in the state of Delaware. Or if you use the internet and you would like to compare the plans, you can also go to the Medicare.gov website. On that website, you will actually be able to enroll in a Medicare Part D drug plan. You can contact the plans and they will give you a confirmation number for those plans. So if you would like for us to provide you with that plan comparison, please feel free to reach out to our office, again, with a list of the medications that you take, the dosage, the frequency in which you take those medications. Also, let us know which pharmacy you use. Depending on which pharmacy you choose does change the price. So we can, again, provide you with a comparison by contacting our office.